I will discuss about the isolation and the tooth separation. If you see the importance of an isolation, it is an ideal operative procedure can be a task of all the restorative materials, especially the adhesive materials which require a clean dry field to obtain the best properties. So the goals of isolation is to control the moisture which helps in excluding the eliminating the saliva and also helps in retracting the soft tissues and the protection of the patient by preventing the aspiration of the small instruments and also helps in improved quality of the treatment by improving the optimal conditions. Now we'll see methods of isolation that includes the cotton rolls that has in its own importance in satisfying the dryness, and they are placed at the salivary gland duct exit so they can absorb the saliva. And for maxillary teeth, the cotton rolls are placed in the facial vestibule adjacent to the involved teeth, and for the mandibular, they are placed in the facial and lingual vestibule. If you see the rubber dam was introduced by S.C. Barnum, and it is a flat thin sheet of the latex or the non-latex that is held by a clamp. Now we'll see advantages of the rubber dam. They will provide the dry, clean operative field by increasing the maximum access and the visibility to the area, and also helps in improving the properties of the dental material, which are especially true for adhesive materials. They help in protecting the patient from swallowing or aspiring the uh, debris and the instrument, and also helps in protecting the dentist from infections from the patient, especially the hepatitis B. They increase the operating efficiency of the procedure by eliminating the need for conversation and repeated spitting from it. Now we'll see the disadvantages. The patient objection is due to the psychological reasons. That's the reason they may object the use of rubber dam, and the time's consumption. Rubber dam takes time to apply and remove, but this can be reduced to 3 to 5 minutes with an experience. If you see the indications of the rubber dam, they are usually used routinely for endodontic practice and endodontic procedures while they are in contact with irrigants like sodium hypochlorite, and also for excavation of the deep caries. They are used for adhesive restoration so that they ensure the complete dryness during restorative procedures, and also for the bleaching procedures to prevent the damage to the adjacent soft tissues from caustic bleaching agents. Now we'll see the contraindications of the use of rubber dam. Teeth that do not have or completely not erupted sufficiently to support a retainer is contraindicated for rubber dam placement. And also extremely malpositioned teeth are also contraindicated for rubber dam. And some third molars which are not properly erupted or malpositions are contraindicated for rubber dam, and asthmatic patients with the breathing problems and the patients who are allergic to latex are contraindicated for rubber dam usage. Now we'll see the rubber dam equipment. The rubber dam equipment consists of rubber dam sheets which are made up of latex rubber which are supplied as 5 into 5 or 6 into 6 square ready-made cut sheets. They are available as a dark color such as green and blue, and generally preferred as they provide good contrast with the teeth, and in fragments are torn off and left behind interproximally so that they can be easily removed. And they are of various thickness such as the thin to special heavy, and whereas the heavy 0.25 mm thickness is used for placing the posterior restorations. And the rubber dam frame is that holds the borders of the rubber dam material, preventing from falling in the mouth back into the mouth. Next is the rubber dam template. The rubber dam template consists of the maxillary and the mandibular mandibular teeth with an inked rubber dam stamp that helps in marking the dots on the rubber according to the average position of the teeth. If you see the clamp, we have the winged and the wingless clamp. The rubber dam have the clamps have four prongs, which are and two jaws connected by a bow, and they are available in different sizes and shapes for specific teeth. And the clamp should have the 4-point contact on the teeth without rocking or tilting. We can also see the wingless clamp. And we have 12 sets of rubber dam clamps which are used from anterior to the posterior. Anterior one is also called as butterfly clamp. Now we can see the rubber dam punch. However, this is a precision instrument which has rotating metal disc with 6 holes of varying sizes and a tapered sharp pointed plunger. The punch is used to cut the holes on the rubber dam sheet, and the smaller holes are for incisors, canines, and premolars, whereas for the larger holes are for molars. There are two designs of the punches available. One is the hygienic, another is the ivory design. Now we can also see the rubber dam forceps. This is instrument used for placing, adjusting, and removing the clamps. Now we'll see the wedges. The wedges are nothing but they are available as a rubber material which are placed interproximally in between the uh, rubber dam sheets. We'll see the rubber dam application methods. The rubber dam can be placed in three methods. One is like clamp placement prior to the rubber dam helps in rubber dam isolation, and it also helps in safety against the aspiration and ingestion. Next would be the clamp and the rubber dam placed together. The winged clamps are preferred in this technique. Next is the clamp placed after the rubber dam. This technique requires the help of an assistant for quick application. Now we'll see the special situations for rubber dam placement. One is the silker Glickman clamp. In the severely broken down teeth, this can be used. In this technique, these are also known as modified clamp, and the clamps with prongs inclined apically with the tiger clamps. Next is a split dam technique. In this, the two holes are punched in a dam at least 5 mm apart that corresponds to the teeth anteriorly and posteriorly in a quadrant, and the widget is placed towards the anterior tooth. Next is the errors in the rubber dam placement. One of the error may be the off-center arch form. It may be caused due to the improper hole placement. So the excess dam material can be folded under the nose or cut under from the patient's nose so that it can be prevented. Next is the improper distance between the holes. This is due to the incorrect punching of the holes, and this is also can be corrected by placing the rubber dam and adjusting for the malpositioned teeth. And the incorrect choice of the retainer. So the selecting the retainer without verifying its fit is also one of the cause of it. Another is the torn dam. Here, the incorrect selection of the dam material is one of the cause which may lead to the leakage and the poor moisture control. So the proper selection of the appropriate material helps in preventing the torn dam. Now we can see the other methods such as the saliva ejectors. The saliva ejector aspirates the saliva collected in the floor of the mouth and also removes the water spray from the eroder during cavity preparation procedures. But it works at a slower rate when compared to the high volume evacuator. Next is a sphiropter. It is a combination of the saliva ejector and the tongue retractor. It removes the saliva and retracts and protects the tongue, and useful while working in the mandibular arch. Next are the high volume evacuators. This is the device used to suction the water spray from the aerator when it's in use. The speed of the suction is high when compared to the other saliva ejectors. Next, we'll see about the throat shields. These are the Spotch gauge, which consist of 2 into 2 inch, which is unfolded and spread over the tongue and the posterior part of the mouth. Next, we'll see other adjuncts such as mouth props. These are the adjuncts used to restore in the restorative treatment in posterior teeth, especially for lengthy appointments. They can be of two types, block type or the ratchet type. The block type is most commonly used one. Now we'll discuss about the recent advances of the rubber dam or for the isolation procedures. That is the cushioning clamp. Here, if you see, the ferret N is a material that can be pressed in the embrasure area and it is light cured over which the clamp is seated. And they are in a shape of the cashew. That's the reason they are known as the cushioning material. Next would be the rubber dam, that is dry dam. The rubber dam laminated with the paper on the both sides and attached strips are known as a dry dam. Next, we'll see about the ISO-Light. It's a new dental device that simultaneously provides light, suction, retraction, and prevention of the aspiration. And is the Optra dam. It is a 3D technique. It is used to establish a completely dry treatment field as an dam is automatically stretched in an oral direction and automatic hold of the device is placed. Now we'll see the handy dam. It is a foldable radiolucent flame and the plastic tube is inserted in the preparation holes to keep the dam open. Now we'll see the Insti dam. The Insti dam is nothing but in this, if we observe, we have a hole in the center of the dam that helps in directly placing the dam in a position.